Welcome to the DKA channel. I'm your host, Ness David, and thank you for joining us. In today's episode, we are going to discuss the role of a case manager in the hospital setting. And to help me discuss that is our wonderful guest here who has been a long-time nurse and currently practicing as a case manager, Saba. And so, hi, Saba, and welcome to the DKA show. And can you please tell us a little bit more about yourself?
Yes. Thank you, David, for having me join you today on this episode. My name is Saba, and I have been a registered nurse for more than 20 years. And I have practiced in different settings, mostly in the hospital setting. And I've been practicing in the Seattle area in Washington State. I've done different kind of nursing. I have been a charge nurse, float pool, you name it. I've done a lot of it. And about 4 years ago is when I started to be a case manager, still in a hospital setting.
Oh, nice. And so how long did you practice actually at the bedside before transitioning into your current role?
It has been at least 22, 23 years. I practice bedside nursing. And I left bedside nursing in 2021 after the COVID. Well, COVID was going on. And that's when I went and became a case manager. So it's been about 4 years now.
Nice. So what does it take, as practicing case manager, what does it take to become one?
Okay, that's an excellent question. And for me, having practiced nursing, different type of nursing has really helped. There is really no formal training to be a case manager. So it's on-the-job training. So when I went to become a case manager, I did have a 6 weeks training, hands-on, taking patient, had preceptors. There is a lot of education, material you study, regulation, stuff like that. So the didactics and then the practice. So altogether about 6 weeks, hands-on.
6 weeks hands-on.
Yes.
Wow. I didn't know that, right? I thought maybe there is a special training that you have to go do, like maybe this certification for med-surg or ICU and stuff like that. I thought maybe there was a certification like that for case management. But
there is a...
There is?
Yes, there is a certification for case management through the American Association of Case Management, the ACMA. The requirement is for you to, if you have a bachelor degree, they do want you to have at least a 2 year of practice. And if you do have a master's, it's about 1 year, and you can sit for the exam. So
is it like 1 year, 2 years of practice as a case manager before taking the...
Exactly.
Oh, okay. So you don't have to take the exam before becoming a case manager?
No, you don't.
Oh, okay.
You actually have to have worked in that position, and your direct supervisor does have to attest that you have been. So if you do have a master's 1 year, you can sit for the exam.
Oh, nice.
Yes.
Oh. And so, let me ask this. So, how in the in the nursing world you'd have, like, let's say, some specialties, right? Like somebody doing L&D and somebody doing like acute care, somebody in an ED. In the case manager world, do you guys have anything like that where like are there differences in the kind of things you do as a case manager? Like, are there any different types of case managers?
What I do now is inpatient case management, but there's outpatient case management.
Oh.
So like, let's say, home health agencies would have case managers. It's outpatient. There is some insurance entities who do employ a case manager, and usually it's like preventing readmission, disease management, and following up with the patient, and for better outcome.
Oh, nice.
So those are the ones. Social workers can do that as well.
Yeah, and that brings me into asking you this question, where the difference between let's say the RN case manager and somebody who is like trained as a social worker, is there like any like difference in the kind of work you guys do, and how does it look like?
So the roles are pretty aligned, but also different. For like social workers, they do the psychosocial assessment on patient. They do a lot of behavioral health assessment, substance use disorder, like a whole, and the drugs. So they do a lot of that, and they mainly do like adoptions for newborns. So they cover like the special care nurseries, the maternity ward. So that's one of the roles they do. They have a lot more knowledge of the community resources, I feel like. So social workers are very valuable. I know some hospitals, they do have a social worker and an RN on a case, on a patient, because the social worker can handle the psychosocial, like the housing, disability paperwork, stuff like that, where the RN is more clinical.
Gotcha.
So we mainly work like, for, let's say, setting up home health, home infusion, discharges to like ambulatory centers, stuff like that. So there is a little bit of difference, but at the place where I'm working right now, we basically do almost the same assignment, same kind of work.
Yeah.
But like I said, if it's like psychosocial assessment, counseling, the social workers would come in, so we would ask for them to get on the case.
Yeah, which is very interesting because I didn't really know the clear differences between the work that the social worker does and the case manager does.
Yeah.
So you coming here and talking about this is very helpful.
Yeah.
It really clarified that in my head, and I can really see the difference in the roles now, which I think most of our viewers who don't also have enough experience or know the difference would, through this conversation would get to know
Yes.
the exact role of the case manager and the social worker. So like you said, if I understand you right, the social worker focuses on the psychosocial issues, and whilst the case manager focuses more on the clinical issues. Anyways, yeah, if you've been with us to this point, thank you very much for being with us. You had Saba here with us with this amazing depth of knowledge and resource and experience right here with us, who have told us all about what case management and their role in care coordination. We really, really appreciate you for coming to share that knowledge with us. The other thing that I want you guys to know is that if you have questions, please put them in the comments. You can always like, share, and subscribe to this channel. Thank you for joining us once again. I am your host, David, and I'll see you in the next episode. And this is the DKA channel.